Good morning, ma'am. I am Sheralyn Pelayo, and I will be going to report about the implementation, the POC Implementation Protocol, and the personal requirements. So first is the implementation. Under implementation is we have establishing need. So when establishing a POCT site, the approach and steps for setting up a POCT site will vary in almost every instance. However, in almost every circumstance, certain general implementation rules are applicable. So just like support, diba, you should support the organization and you should have the willingness and readiness to evaluate the request for POCT. But before implementing a POCT service, an interdisciplinary committee should address the questions similar to those listed in Box 29.1. So what are these questions? So first is which test is required and in which specific area? How is the service currently provided, and is this a means to resolve a problem? What is the expected annual test volume? What clinical question is being asked when requesting this test? What clinical decision is likely to be made and action to be taken upon receipt of the result? How will POCT increase patient satisfaction? Are personnel competent to perform the POCT? Are facilities available to perform the tests and store equipment, reagents, and documentation? Will a change in practice be required? Can the central laboratory deliver the required service? And how do the POCT costs, reference ranges, accuracy, and precision compared to similar tests in a laboratory? Are available POCT analyzers user-friendly? And can POCT analyzers interface with a laboratory information system and a patient electronic medical record? Are both internal and external QC materials available? And what proficiency testing and maintenance are required? And can staff workload accommodate the requirements? And thus the company providing the POCT analyzers and reagents offer a reliable installation and support service. So this decision to establish a POCT program is made after justifying the clinical need, cost comparisons, and the analytical performance requirements. And also, you should consider other factors such as the available space, a prior history of regulatory compliance, testing personnel, laboratory staff who will be managing the training and supervising the POCT program, and the quantifiable quality metrics. So the next is the POCT Implementation Protocol. So after you are done making the decision to implement the POCT, the responsible party selects the method of choice and begins validation. And then the manufacturer should assist in supplying instrument manuals, package inserts for reagents and QCs, material safety data sheets, and training materials in addition to the minimal acceptable standards. Additionally, the instrumentation setup and validation investigations are frequently assisted by the manufacturer. Take note that a procedure or the policy should be written for each test with the assistance of the manufacturer. These documents shouldn't just be a collection of information collected from a manufacturer. Rather, they should help create a clear, concise, and easy to follow protocol that is appropriate for the site carrying out of the test. And also, the procedure should contain information on the method's basic principles, the qualification of the personnel using it, the types of specimens that must be used, how to handle them, the reagents, supplies, and equipment that must be used, how to test patients, how to troubleshoot problems, the reference ranges, the reporting limits, and if necessary, any interfering substances. All are required regulatory or certifying standards should be in place prior to initiating patient testing. So first is the quality management. The POCT program has a written QM program as well as an organizational system setting forth levels of authority, responsibility, and accountability. So the organization must define responsibility and accountability for persons who perform or supervise the POCT testing. So this may include an organizational chart, a policy defining personnel designated to perform various tasks, and a set of policies defining responsibilities of the POCT users. These elements may be combined in one document or included in laboratory policies on delegation of responsibilities in individual POCT policies. So always choose the most suitable employee with the skills and competencies to fulfill the requirements. And then there is a documented system to address unusual patient results or instrument troubleshooting. There is a written procedure for each POCT. So this system may need to include feedback from the clinicians with subsequent investigation and monitoring of patient results for unusual suggesting analytic error. So, where POCT personnel are also individuals who will act upon test results, there should be defined criteria for collecting unexpected test results with other clinical findings to confirm such results whenever possible. So, the intent of this requirement is not to require confirmation of all results outside their reference interval. So, second is the specimen handling. There is a documented procedure describing methods for required patient identification and preparation, as well as for specimen collection, accessioning, and preservation before testing. There is a procedure for entering POCT results into the permanent medical record of a patient. Reference ranges should be established and accompany posted POCT results. So, a specimen handling together with the adequate patient preparation, specimen collection are essential prerequisites for accurate test results. The accuracy of test results is dependent on the integrity of specimens. Improper handling during one or more of the steps may lead to disqualification of samples before analysis and ultimately lead to incorrect test results. So third is the reagents. So all reagents should be stored and labeled as recommended by the manufacturer. So no chemical shall be accepted without an adequate and identifying label. Original containers should be labeled with the date received and the date opened. When reagents arrive from the manufacturer, the labels are intended to communicate the hazards and precautions of handling a particular chemical to the researchers and professionals who will be using the chemical. And also, reagents that are stored properly have a much longer shelf life and maintain their maximum effectiveness than those that are improperly stored. So all chemicals must be stored in a safe, secure location. So just like a hazardous chemicals, it must be stored below eye level. So do not store chemicals on the floor, window ledges, or balconies. Keep containers closed unless you are dispensing a chemical or adding to the container. Next is the instruments and equipment. Equipment must be evaluated and scheduled for regular maintenance, as required by the manufacturer. Equipment maintenance documentation is required. So, with regular inspection, you make sure your equipment is in top shape and can handle the toughest jobs. A trained technician can determine if small repairs will make a big difference and can suggest repairs to help your equipment run more efficiently. Most importantly, regular inspections ensure the safety of your workers. So you can get projects done on schedule and with peace of mind, knowing your equipment is in good condition. And then documenting every repair or maintenance work done on your equipment will help you process warranty claims much easier. And it keeps a record of the type of maintenance work done to your equipment as well as the exact time and date repairs were done, as this information will help determine your rights for the warranty claims. Next is the personnel. The director of POCT program is a physician or doctoral scientist. The testing personnel have adequate, specific training to ensure competence and must be documented to meet compliance or accreditation standards. So, even though you are now a professional medical technologist or you are a personnel or supervisor, you are still required to undergo training, attend seminars or symposium in order to gain new knowledge and principles about the profession. And then the competence and awareness defines the guidelines that must be followed by all staff in order to be considered competent and aware of the requirements. So, in other words, this procedure ensures that all employees are performing to their best ability in their specific areas of expertise, undertaking the necessary actions and responsibilities for ensuring that the competencies needed to meet customer and other external or internal requirements applicable to the business are defined and actions are taken to meet these needs. So this procedure also defines the responsibilities for planning, reporting, and retaining associated records. Next is the quality control and calibration. Calibrations and quality controls are performed at regular intervals, at least each day of the patient testing. Acceptable limits are defined for control procedures, and there are documented corrective actions when control results exceed defined acceptability limits. Upper and lower limits of the analytical measurement range for each analyte are defined. So, this calibration defines the accuracy and quality of measurements recorded using a piece of equipment. So, over time, there is a tendency for results and accuracy to drift when using particular technologies or measuring particular parameters, such as the temperature and humidity. So, the significance of calibration is that it maintains accuracy, standardization, and repeatability measurements, assuring reliable benchmarks and results. So, without regular calibration, equipment can fall out of spec, provide inaccurate measurement, and threaten quality, safety, and equipment longevity. While calibrators are used to adjust customer systems to an established reference system or method, controls verify the recovery level of the standardized reagents and calibrators. Calibrators and controls ensure reliability and consistency of assay results. So, lastly, is the safety. There is a program to assure that the safety of patients and healthcare personnel is not compromised by the POCT. Specific safety guidelines are provided by the accrediting body. So, the inspection should review relevant requirements from the safety section of the Laboratory General Checklist to assure that the POCT program is in compliance. The last topic is all about the personal requirements. Institutions are expected to have a specific organizational and administrative structure where staff members have specified credentials, competency, and experience for POC programs with any complexity testing, including those POC programs with a certificate of waiver or a certificate for PPMP. So for POC programs, the laboratory director is often either a PhD scientist or a doctor with a license to practice in the state where the laboratory is located. A director's duties are extremely varied and include formulating policies, ensuring that regulations are followed, and doing administrative tasks. Most importantly, the director is in charge of how well all the tests perform analytically. The director must constantly assess technical or clinical choices. So such individuals should be a liaison between the clinicians, hospital administration, and laboratory personnel. So liaison means communication or cooperation which facilitates a close working relationship between people or organizations. And also, A technical and a clinical consultant are also required for laboratories that perform tests of intermediate complexity, while the clinical consultant is obliged to offer clinical and medical guidance. The technical consultant is in charge of the POCT's scientific monitoring. POCT programs director, technical consultant, and clinical consultant could be all the same person. Also, Um, the laboratory is always the entity in charge of the POCT program's quality management. Even though the implementation of the POCT program may be carried out differently depending on an institution, therefore, it is advantageous for a laboratory to have someone in charge of overseeing the POCT program, and a POCT coordinator frequently serves this job. The POCC keeps an eye on the testing team's daily activities, including the test results monitoring. Also, the POCC is in charge of organizing the POC patient testing and facilitating compliance with rules, procedures, and legal requirements. And he or she also creates a training program for those who administer tests and make sure that competency training is documented. Although the clinical staff conducts the actual testing, the laboratory is in charge of the POCT policies and procedure. In this way, it will be easier to resolve issues that might come up throughout the test process if the operators and the laboratory work together to create a relationship. So, in this decentralized testing model, each institution may have its own unique procedures for training, maintaining competency records, and ordering reagents. The laboratory must keep an eye on the POCT areas and regularly report on any violations of any rules that may be enforced. Weekly rounds or monthly audits can help with this crucial information. However, clarifying individual roles and expectations prior to any testing is essential for the program's success.